You know that moment. The room is dark. The light feels cruel. There is that familiar throbbing behind one eye, or behind your forehead, and your whole nervous system is begging for silence. So you reach for the same thing you have reached for 100 times before. Your Triptan, your Excedrin, your pain pill, the thing that promises relief fast. And yes, it may quiet the storm today. But then something devastating happens. 3 days later, sometimes 1 day later, sometimes even the next morning, the migraine is back. And it feels angrier, louder, and more relentless than before. That is the trap. And for a lot of people, the medicine they trust to stop the pain is quietly becoming part of the pain cycle. Before we go any further, I need to say this clearly and exactly. This video is for educational purposes only. If you experience the worst headache of your life, a thunderclap headache, sudden numbness, or difficulty speaking, this is a medical emergency. Call 911 immediately. Never stop prescribed neurological medications without consulting your doctor. That is not a formality. That is real safety. A sudden severe headache can signal a medical emergency, and migraine aura can also include speech difficulty or sensory changes, which is exactly why new, abrupt, or unusual symptoms deserve urgent medical attention. Now here is the reveal that so many people never hear from the pharmacy counter. What you may be calling a bad migraine could actually be medication overuse headache, also known as rebound headache. The International Headache Society defines it as a headache that happens on 15 or more days a month in someone with a pre-existing headache disorder, developing because acute headache medication is being used too often for more than 3 months. In plain English, the brain learns the pattern. The relief becomes temporary. Then the pain returns, often more frequently, and often more stubbornly. And I need you to hear this without shame. This is not weakness. This is not you failing at pain management. This is a nervous system that has been pushed too hard, too often, for too long. The overuse cycle is especially relevant with common acute migraine medicines, including triptans and combination pain relievers with caffeine, which are associated with medication overuse headache when they are used too frequently. In fact, headache specialists warn that needing acute medication more than 2 days a week can be a red flag that the cycle is starting to own you. That is why the next step is not more panic. The next step is understanding the enemy clearly. Is it migraine? Is it tension headache? Is it both? Because once you know what you are treating, you can finally stop feeding the fire. Before you can break the rebound cycle, you have to know what pain you are actually dealing with. Because not every headache is the same enemy. A tension-type headache is usually the body's mechanical stress signal. A pressing, tightening, tight band around the head. Feeling. Often on both sides. Usually mild to moderate. And typically not made worse by routine movement like walking or climbing stairs. It may come with either light sensitivity or sound sensitivity, but usually not both. And it is often more of a pressure pattern than a pulsating attack. That is a very different biology from migraine. Migraine is different. Migraine is not just a bad headache. It is a neurological disorder with recurrent attacks that often include moderate to severe throbbing or pulsating pain, commonly on one side of the head, plus nausea, vomiting, and sensitivity to light, sound, or smell. NINES also notes that current research points to abnormal activity among nerve signals, chemical signals, and blood vessels in the brain. In other words, migraine is a full system brain event, not just a sore muscle problem. And here is where a lot of people get misled. Migraine can come with aura in some patients. Visual changes like flashing lights, trouble speaking, tingling, confusion, or other neurologic symptoms that can appear before the headache or alongside it. That is one reason migraine can feel so frightening. It is not only pain, it can be a whole-body neurological disruption. Tension headache does not usually behave that way. When you hear that someone has a migraine, understand that they may be describing a far more complex brain event than a simple headache. So here is the practical difference I want you to remember. Tension headache often feels like compression. Migraine often feels like a neurological storm. Tension headache is commonly bilateral, pressing, and not aggravated by ordinary activity. Migraine is more likely to be pulsating, moderate to severe, often one-sided, and commonly paired with nausea, vomiting, and sensitivity to light or sound. And the most dangerous mistake is to treat every head pain as if it is the same problem. Because if the real issue is migraine, and the brain is already sensitized, then the wrong pattern of rescue medication can quietly feed the cycle you are trying to escape. That distinction matters, because the path out of chronic headaches starts with clarity. Not fear. Not guesswork. Clarity. And once you can see whether you are dealing with mechanical tension, migraine biology, or a mixed picture, you can finally stop attacking your body blindly and start supporting the nervous system intelligently. Now let's open the hood and look at what these pills are actually doing. Acute migraine medications are designed to abort an attack, not to build long-term resilience. Triptans act on the trigeminovascular system and reduce migraine signaling, including CGRP-related activity, which is why they can be so effective in the short term. NSAIDs also have a real role in acute treatment. The problem is not that these medications are bad. The problem is what happens when a brain that is already vulnerable gets that rescue signal too often. Here is the line people rarely get told clearly enough. When acute medications are used too frequently, the headache system can become more sensitive, not less. The International Classification of Headache Disorders defines medication overuse headache as headache on 15 or more days per month in someone with a pre-existing headache disorder, with regular overuse for more than 3 months. For triptans and many combination analgesics, the overuse threshold is 10 days per month. For simple analgesics and NSAIDs, it is generally 15 days per month. That is the clinical boundary where the rescue pattern starts to become a risk factor for chronicity. And this is where the neuroscience gets important. Reviews of medication overuse headache describe central sensitization, a state in which the trigeminal and pain networks become more excitable and easier to trigger. In plain English, the alarm system gets louder, faster, and more reactive. Some people notice this as scalp tenderness, more frequent headaches, more easily triggered attacks, or pain that seems to spread beyond the original pattern. So when I say the pill can become part of the problem, I am not speaking emotionally. I am describing a brain that has been trained into hyper-alertness. That is why the rebound feels so cruel. The medication helps, the brain relaxes, and then when the medicine wears off, the system is already primed to fire again. That is the loop. Temporary shutdown, then heightened rebound, then another dose, then another dip in the pain threshold. Some studies and reviews describe this as a chronic cycle of worsening headache frequency and disability that improves when overuse stops. And yes, that is why many headache specialists describe the most effective treatment as detoxification by discontinuing the overused medication under medical supervision. So here is the whistleblower truth. If you are living on rescue medication, you may not just be treating migraine. You may be training the nervous system to expect pain. That does not mean you blame yourself. It means you change the strategy. Work with your neurologist to taper medications safely, especially if you have been using them frequently or if your headaches are daily. Detoxification and prophylactic care can reduce disability and, in many patients, help the sensitized system calm down again. The goal is not to panic. The goal is to break the cycle so your brain can stop living in a constant state of alarm. Now we get to the part that actually changes lives. Because once medication overuse headache is identified, the solution is not to keep chasing the pain harder. The first move is to break the overuse pattern under medical supervision. Current headache guidance describes treatment in stages. Educate the patient about the relationship between frequent acute medication use and headache chronicity. Then reduce and limit acute medication, and at the same time consider preventive care when appropriate. In many cases, withdrawal is the foundation of treatment, and experts emphasize that the approach must be individualized. And I want to be very precise here. Work with your neurologist to taper medications safely. For triptans, simple analgesics, NSAIDs, and combination pain relievers, the literature commonly supports abrupt withdrawal as the treatment of choice. For opioids, barbiturates, and benzodiazepines, gradual withdrawal is preferred. That distinction matters because different drugs create different withdrawal risks. This is not about willpower. It is about using the right protocol for the right medication. During that transition, the nervous system may feel louder before it feels better. That is why many headache teams pair withdrawal with preventive treatment and support strategies. Guidelines note that prophylaxis can help in chronic migraine with medication overuse, and non-drug interventions should be added alongside medical care. In other words, while the overused rescue medication is being stepped back, the brain is being given a new environment, more stability, less reactivity, and better support. This is where a holistic adjunct can be genuinely useful. Migraine care does not live on pills alone. Evidence-based non-pharmacological approaches include behavioral therapy, biofeedback, relaxation, mindfulness, regular meals, sleep consistency, exercise, and stress management. Behavioral options such as biofeedback, CBT, and relaxation are described as safe and well-tolerated preventive therapies for migraine, and they can be especially helpful when the nervous system has become overprotected and overreactive. That is the logic behind a program like the Migraine and Headache Program. Not as a cure, not as a replacement for medical care, but as a structured blueprint to help calm the system during recovery. So the goal is not to white-knuckle your way through headaches. The goal is to retrain the environment your brain lives in. Quiet the overuse loop. Reduce structural strain. Support relaxation. Restore consistency. And give the sensitized system a chance to settle down. That is how you move from constant rescue mode into long-term support for neurological health. So let's bring this home. If you have been living in the dark, taking rescue medication over and over, and wondering why the headaches keep coming back harder, I want you to hear this with compassion. You are not broken. You may be caught in a learned pain loop, and learned loops can be changed. Medication overuse headache is a recognized condition, and treatment centers on breaking the overuse pattern and restoring steadier brain function under medical guidance. The real win is not the next quick fix. The real win is reducing frequency, reducing sensitivity, and rebuilding confidence in your nervous system. That usually means working with your clinician on a safe medication plan, using preventive strategies when appropriate, and adding non-drug supports that calm the system instead of provoking it. Evidence-based behavioral tools like relaxation, biofeedback, and stress management strategies are part of modern migraine care because they help lower the brain's threat response over time. That is why a holistic blueprint like the Migraine and Headache program can be a meaningful lifestyle adjunct during recovery. Targeted breathing, tension release, and nervous system calming strategies to support the body while the rebound cycle is being broken. Not a cure. Not a miracle. A structured support system for a brain that has been overworked for too long. Stop fueling the fire with daily pain pills. Break the rebound cycle. Support your nervous system. And reclaim your life from the darkness, one safer step at a time. This video is for educational purposes only. It is not a diagnosis or a treatment plan. If you have sudden severe headache, numbness, weakness, confusion, or difficulty speaking, seek emergency care immediately. Never stop prescribed medications without speaking with your doctor first.